ADD is actually an old name for what is now called ADHD, predominantly inattentive subtype. So we have ADHD, predominantly inattentive subtype, predominantly hyperactive impulsive subtype, and a combined subtype.
The symptoms of inattention look like distractibility, daydreaming, some disorganization, so seeming to be off task, seeming to be behind because they're not fully attending.
With inattention, a lot of times these kids are not noticed actually right away because they don't cause any real trouble. They're just not focused so much in school. So one of the signs might be that homework doesn't get done or assignments aren't completed fully.
They're often disorganized. The backpacks will be full of papers. The desk will be, full of papers or wrappers or, pencils and pens, and it's very difficult to find things, which makes it very difficult to be productive.
Naturally smart children, and this is, I think, important for parents to know, naturally smart children can sometimes mask that difficulty until the natural intelligence is outweighed by new content that needs to be learned. And then we tend to see that even really smart kids will struggle.
So ADHD can affect socialization in that kids who are inattentive, it's hard for them to keep up with the games, hard for them to keep up with rules. If we're playing football and I'm going to pass you the ball, you might be looking up at the sky and daydreaming. And so sometimes that makes it frustrating for kids to have that level of engagement with another kid who's not on task in that way. It sometimes becomes frustrating for parents or even siblings when it seems like their child or their sibling is not paying attention. Their name is being called, but they're not responding because they're daydreaming or inattentive. The disorganization also sometimes creates a lot of conflict because the rooms are junky, the cabinets are left open, the doors are left open.
ADHD is treated primarily with medications. There are also some therapies that can be helpful in sort of organizing and planning. There are going to be times where even the medications aren't going to help every part of their ADHD. They're going to have to learn how to organize their folders a little bit better. They're going to have to learn how to attend in class a little bit better. And so sometimes therapies can be helpful in developing those better habits.